Hi there, this is Marielle Conception, your host of the My DPC Story podcast. Have you or someone you care about ever been burned by the U.S. healthcare system? If so, you are listening to the right video, because if you are listening, chances are the answer is yes. But the U.S. spends so much on healthcare. Why are so many Americans affected personally and especially financially by the healthcare system? Shouldn't that mean we have better healthcare access and treatment options? Shouldn't it be easy for us to be able to see our doctor when we need to instead of turning to the ER or urgent care? Historically, it's been seemingly impossible to answer these questions. But now that is changing through the direct primary care movement. This video that you have tuned into will bring you into the world of direct primary care and show you how physicians all over the country are changing the way they practice so patients from all backgrounds get the high quality care they need and deserve, which makes for both happy patients and physicians. Learn even more by subscribing to the My DPC Story YouTube channel. Find us on all major podcast platforms. Find us on socials at My DPC Story and at mydpcstory.com. There you can find resources including how to find a DPC doctor near you, conferences about DPC, DPC startup guides and advice, a store with DPC swag, and even a mapper showing where podcast guests are practicing. Thanks for tuning in to hear about this powerful movement. Now, on to the episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
I think physicians are simply patient advocates, patient advisors for their health, and DPC removes other typically non-clinical people, large hospital administrations, insurance companies, and it allows the patient to simply be advised by the doctor in making decisions for their health. I'm Dr. Kate Snodgrass, and this is my DPC story.
Dr. Snodgrass completed her undergrad at Henderson State University and then attended the University of Arkansas for Medical Sciences College of Medicine. She went on to complete her residency at Columbus Regional Family Medicine, now Family Medicine Residency Program at Piedmont Columbus Regional Midtown Campus in Columbus, Georgia. She worked 2 years at Virginia Hospital Center in Arlington, Virginia, and 1 year at CHI St. Vincent in Hot Springs, Arkansas, both in the outpatient setting. From 2016 to 2017, she served as a Peace Corps medical officer in Namibia, providing medical care to American Peace Corps volunteers while she and her family were stationed at the embassy in Namibia for her husband's work with the State Department. Prior to joining First Primary Care, she was practicing for a year at MedStar Urgent Care in Arlington, Virginia. In October of 2019, she joined her first DPC practice, First Primary Care, where she has been enjoying providing her patients direct care for over a year. Welcome to the podcast, Dr. Snodgrass.
Hi, thank you so much for having me.
It's such a pleasure to have you on the podcast. I wanted to start with asking you about your experience in the Peace Corps. How did you get involved in the Peace Corps, and what did you gain from this experience?
The Peace Corps was really a once-in-a-lifetime experience. The Peace Corps actually doesn't hire American doctors anymore to take care of Peace Corps volunteers. They actually hire doctors within the various countries where the volunteers are stationed. So I'm not really sure exactly how I was able to get the job. It's a long story in itself, but I moved to Namibia and we actually lived there 2 years. And the first year that we lived there, the entire year was me trying to get the Namibian board to allow me to sit for the medical exam. They have an oral exam in Namibia. And I think I just made connections through that year. Namibia has a brand new medical school. At that time, it was probably 7 years old, and now it's maybe 10 years old. And I met some faculty there and was able to teach some of the basic anatomy courses, some of the basic exam courses, and also get out into the community with the medical students and kind of precept them in that setting. I did that for maybe 9 months. And I believe, I'm not honestly sure how I ended up getting to sit for the board, but about the 23rd time I walked into the building to ask them, what was the status of my application, they actually gave me a date and let me sit before the board. And so I finally got my license. And then after that, I was able to apply for the Peace Corps medical officer position. And I actually got turned down a couple of times because they said that they wanted local doctors only. I'd been turned down twice, and the third time they called and they offered me an interview and the job. And then I was able to work in Namibia as a Peace Corps medical officer. And it was exciting. It was exactly what you might expect. We had volunteers that were spit in the eye by spitting cobras, and we had many volunteers with scorpion bites. And in Namibia, some of the scorpions are actually deadly. So, a lot of identification of things. When volunteers were bitten by snakes, we would consult with a physician in Namibia. He was actually an ENT, but his father specialized in reptiles and all of those creatures. And so he, by default, kind of became the expert in the country. So we would consult with him and had pictures of the snakes and things. And then we also did a lot of just primary care for the volunteers that were there. It was just such a phenomenal experience. I'm honestly not sure how it all the stars aligned, but I'm so thankful that they did.
That's incredible. And at the time, you had your son or daughter with you, or both?
I had my daughter. We moved there. She was 3. And then when we moved back to the States, she must have been about 4 or 5.
When people talk about going overseas, there's a difference between medical tourism and organizations that are there year round. Going into Namibia and practicing in an existing system, how was that in terms of continuity for you and the people that you served?
There is a huge difference between visiting a country and living there for 2 years. We lived there because my husband worked at the embassy. I was able to see the difference in care between people with money and without money is so stark. There were beautiful new hospitals where you could get great first world care. And we actually had to go there. My daughter actually ended up with dysentery. I wasn't aware when we went to the ER that's what she had, but she ended up having dysentery. So we were admitted, and it was a beautiful place. And then I also was in the state hospitals with the students. I also had a visit there. We had a housekeeper that came to our house 5 days a week, and her daughter got very sick. And the daughter was my age. So at the time I was, I think, 32. And her daughter was diagnosed with HIV, and she was in the hospital for weeks and weeks. And finally, I agreed to go and just see her and see if I could offer anything to help our housekeeper, whose name was Paulina, understand what was going on and what was happening with her care. I said, I had told Paulina, it's HIV. Like, there's treatment. She'll get treatment and she'll just be on medication and live her life. Well, that's the case if you have money. If you don't have money, that's not what happens. And I don't know the details that occurred, but when I went to see her, she was covered in Kaposi's sarcoma. And there was, there's really nothing that I could offer other than trying to explain to Paulina what was happening. And then I believe that week she was transported to the TB hospital. They have a separate TB hospital because it's so rampant in Namibia in certain areas. And she died about a week later. And so, I saw so many different angles of the healthcare in Namibia, and it truly changed my life. We also helped with the burial of her daughter because they didn't have the money. And I actually went to the market, and you walk back between these buildings, and lifted up is like a garage door, and inside the garage door are caskets that you can pick from, maybe 6 caskets that the family would come and pick a casket. And then the person that owned the building asked me, well, do you want to see where we keep the bodies? And it was just right here in this open air market. And there were, I think, 9, there were stacked 3 each of these, I don't know what you call them, the long cylinders where you keep bodies of before the person is buried. And, it was all just right there in this market. So it was just so eye-opening to come from America, where all of that's very hidden from us, and to see what death is like in that country for people who don't have very much money. And they're very close to death there. They see it. It's not something that's hidden away and the body's swept away and you don't see it until it's prepared in the casket. It's very different than it is in the U.S.
As somebody who's traveled overseas to do medical service, it's so tragic and humbling when you hear or see or experience things like that. Such a young life. And when we treat HIV like diabetes or hypertension here, it absolutely is devastating to know that she could have benefited from something as simple as a pill regimen. When you think about your care now, having gone through that experience and having lived in Namibia and having seen that difference between the haves and the have-nots, how has that affected your medical care once you got back to the States?
I think I'm just so grateful that we have the ability to have the care that we want. And even for those that are financially disadvantaged, there are ways that the government is able to support them in receiving care. I know there's a lot of issues at times with that, but even the poorest of poor in the U.S. are considered very rich in many other countries.
On that note, I want to ask, did that drive your desire to practice in a direct primary care clinic versus a fee-for-service model?
I say that instead of I found DPC, DPC found me, and I'm so glad that it found me, because we got back from Africa and we were living in Arlington, Virginia. I was working at an urgent care, and when my husband changed jobs, we were tired of moving with all of his work, so he changed to a different organization that wouldn't have to move, and they told him that he would be stationed down in Houston, Texas. And so I got on Physician Mom Group, and the Houston one, and I just wrote that we were coming, what are the known opportunities there. And I had about 3 or 4 people write, and one of them was from First Primary Care, where I work now. And I think we were emailing, or we were writing on Facebook about her job, and that it's a little bit different and you take care of your patients virtually a lot. And I really wasn't very excited at all about it, because I had been doing a little bit of teledoc and I did not enjoy that very much. So when I spoke with her on the phone, my expectation was very low, and I talked to her maybe 30, 40 minutes. And by the end of the 40 minutes, I told her that I definitely wanted the job and what was the next step. So, I really feel like DPC found me.
Well, I am truly a believer in that things happen for a reason. And now that it's been over a year since you've been with First Primary Care, how has that experience been for you?
I have really loved it. It took me about a year to adjust to the patients reaching out after hours. And then also the vacations, we really cover each other on vacations. It's not like in a big institution where you just take off and you don't worry at all about who's monitoring your patients. So those are my 2 biggest things I've had to adjust to. But honestly, since my youngest child has gotten older, he's almost 3, that has taken a huge burden off of me. In my house, a lot of the childcare for the really young is mostly my duty. And so now that he's older, I have more space for other things like work and myself.
Had you ever heard of the movement prior to jumping on Facebook and hearing about it?
I had never heard about it. I was shocked. And as I read the Catastrophic Care, that book, Catastrophic Care, my first couple of months while I started this job. And it was so eye-opening to me. I was shocked. I had no clue how much a CT cost. I just assumed it was thousands of dollars and I didn't need to worry about it, or how much medication costs. I remember prescribing amoxicillin for someone and looking on GoodRx and seeing that it was like, $5 or something, and remembering that 4 months prior, I had picked up amoxicillin for my child, and I think I paid like a $50 copay. My eyes have been opened, and I just keep having all of these moments as I'm working where I'm learning so much about medicine. I've been practicing, I got out of residency in 2013. So I practiced all that time and didn't know any of these things.
Sadly, that is a common experience that people have when they leave residency and go into clinical practice. It's definitely something that, I experienced prior to graduating residency. I had never looked up how much a medication cost. I did know from having worked in the Dominican Republic that MRIs were much cheaper because in the DR, there are many facilities where the doctors own the facility, do the patient sitting, do the MRI, and then, read it and put the image on a disc. And a lot of people from Florida will actually fly to the DR to get that done. But, that was my first experience in that people go to extreme lengths to get care that is not really that expensive. And I'm glad you mentioned catastrophic care. I'll add that to the resources in your accompanying blog with the podcast. But I wish that patients read that type of material more. I think that during the pandemic, they have learned a little bit more about access to care. But in terms of cost of care, I don't think that awareness is where we would all like it to be.
I think you have to want to know it. I mean, and I would say especially physicians, as we've been growing at First Primary Care and hiring new physicians, I'm finding that some of them just really are not interested, which is disheartening in a way, but people have to want to know the difference and make the change to actually do it.
I would also extend that to patients as well, in that, when a person is setting up a DPC, whether it be a group of clinics or a micro practice, when patients find the value in a direct primary care modeled clinic, they tend to appreciate things like a doctor looking out for them in terms of their pocketbook. So you're totally right. When we hear stories about patients who did not end up working out with their DPC doctor, we can see in a lot of those cases that the patient didn't value, a doctor taking time to do something like looking at for their pocketbook. But it's so true. You have to want to know that, because it's not like a CVS email that you get in your email box every day. It's something that you have to actively look for.
Yeah. And I'm hopeful that it grows and that more are interested. Who knows, maybe I learned about it a long time ago and don't remember it, and other people are frustrated with me at that stage in my life. But I hope that more patients learn about it and see the value in having that relationship. I mean, especially for kids that are in our practice. We have mostly adults, but I mean, having a child is one of the most terrifying experiences of my life. And I have gone to medical school and residency to learn about kids. So just having a physician there must be so comforting for families.
Absolutely. I laugh at that because just prior to jumping on the podcast interview with you, my youngest son, who's 7 weeks tomorrow, just developed a rash out of nowhere. And so, when you have that happen as a mom and as a doctor, your brain goes in so many directions. And nonsensical thinking is absolutely one of those directions, even though you have medical training. So I can just imagine when something that is, a viral exanthem to us is something that is, a trip to the urgent care for a family, right? And in our locale, the nearest urgent care is 30 minutes away. And with COVID on top of everything, it's just the idea that you can avoid that by calling your doctor, calling you Dr. Snodgrass, and that's amazing. And that's what all patients deserve. But it is a matter of if a patient wants that and values it. When you speak about your patients, I want to ask you if you can share with us a little bit more specifically about your patient panel. You mentioned that you have mostly adults, but what are some of the demographics, and can you give us some more details?
I don't have exact numbers, but I was at First Primary Care And about my year mark, so I joined in October, and I believe by 1st of December, I had 400 patients. And last I checked, I was at 415 last week. So I'm still growing. I have a real mix, and I feel like I'm 50-50 with just recalling who reaches out to me throughout the weeks. Mostly kids will come when a family joins, and the parents will just bring their kids along, and we will see them as well. But we have, retirees who are financially stable and set for the rest of their lives. And then we also have people who are retirees and they need healthcare and can't afford it on the market. Recently, I've been getting a lot of 20 and 30-year-olds in the practice. So it's really a mix, and I think that keeps it really fun.
Because you joined a practice that was already established, how was the experience in developing your panel? Was there a big marketing strategy in place? How did that work?
I have really loved joining a group. I am so inspired by the other physicians that open their own practice and do all of the research to set up all the various aspects that are needed as part of the business. I joined because that's not really my interest, is setting up a practice. And I also really missed camaraderie. As a resident, everyone had camaraderie with their co-residents. And when I left that slowly over time, without really even realizing it, I really lost that. You become separated from your other physicians. And so I wanted to join a group where I could collaborate and commiserate. And that's really what it is like at First Primary Care. We've got our founder, Dr. Goyle, and then Dr. Tivo. And we have another doctor that's about to come on in, I think, this month. And so there's going to be 4 physicians there. And we have an app that Slack that we all talk on. Our whole company talks on Slack. So it's a really fun environment. And I would say most of our patients come from our Google reviews, to be quite honest. So we try to encourage patients, if they've had a good experience, to give us a Google review. And sometimes they come easily and sometimes they don't. But when I onboard, I do a phone call with the patient to invite them to the practice, to let them know what to expect. My first question is always, how did you hear about us? And almost always it's they heard it from a friend or they found us on Google. So a lot of our patients come from there. We also have a fantastic marketing, what do I want to call her? Superstar. She does such a good job. She makes memes, she makes videos. She animates things. It's really been fun, a fun way to be creative. And she comes up with things on her own, but then she'll say, what are you interested in? And I love history. So we came up with like a flu pandemic trivia, and I read a book and we made a video out of that. And then we'll also do videos about various medical issues or things that we're finding that patients are searching a lot on Google. And I don't know how they figure all of that out, but somehow our marketing and our sales team, they all figure that out. And then they come back to us, the physician side, and they say, this is what people are asking about. And so then we'll make a video about it and put it out into YouTube and all our social media.
How much time do you spend as an individual recording sessions?
Not a whole lot. We have a person that does all of that. And so my portion, when I prepare for one, the last one that I did was on stress and nutrition. And so I'm a big preparer. So I spent maybe a month beforehand, I started researching, and I write it out and I rehearse it with my husband, and then I'll tell friends about it, and they'll sometimes give me little things that, their ideas, and I'll put it all together. So probably over a month, but not, continuously working on it. And then the week before, I'm really rehearsing it every single day. And then when I go to do the session with her, I'm there maybe an hour total.
Thank you for mentioning that, because if people are interested in upping their marketing game, that's definitely good to hear. As you mentioned, you have your 4th physician coming on board. How did you guys go about finding your 4th physician?
We now have a a page on our website where physicians can see about the job openings for the physicians in our company. So some of them are coming through there, but we'll post on various PMG groups on the internet, and primarily people will reach out that way. I'm not on Facebook as much, but anytime that we see someone write that they're looking for a job or that they're frustrated with their traditional insurance-based practice, we always write on there. We put our number and we say, give it a try or give us a call, and we'd love to talk about it. So our recruiting process is trying to reach out to people that we see that could be interested in. Our company is very big on finding good people. We want people that really want to be with our organization, with the DPC movement, and that are really going to enjoy it and have fun. And it's not just a job, it's really something that you enjoy doing.
Patients, they can sense that for sure, that, if you're just there for an 8-to-5 job. When I hear people talk about an experience at an urgent care versus when they come to our clinic and they see my husband and I, it's interesting because it's when the patients see what they're glad it's not like on a usual basis that they make comments about how they value spending time with them and talking with them like they're humans. So that's great that you guys are growing, but also being cognizant of who you are having joined.
Yeah, I think it's a balance, because we want people to come, we want them to be interested, and we also want to make sure, that they're good. I think that takes time. I think, when I was hired, I think it's always taking a chance, and you don't really know someone, and it takes a long time to get to know them well. So, that just happens over time. And I really enjoyed my time in urgent care working as well. But you treat a patient and then you lose them and you lack that continuity, which is so nice for DPC. I mean, we get to really follow up with patients and set reminders and see how our intervention has impacted them in the future.
What are some of the strategies that you use personally to build in that continuity?
My main way of communicating is through the Spruce app. And people are so thankful to have follow-up. And they're just so grateful. And I mean, I love to follow up. I want them to be satisfied, but I'm also curious if it helped, if they're better. And so I really love the reminders, because I cannot remember. If I didn't have the Spruce app, there's no way that I would remember to follow up with all of these patients that we're treating.
I love that that's been your experience with Spruce, because even if it is coming out of, I have to do a reminder because, I might forget 10 days from now, to the patient, you are still, like you're saying, following up or sending a reminder to schedule a lab or whatever it is. And that is still, quality built into your process, even if it is, a quick reminder that goes out automatically. I feel it helps the patient feel constantly connected to your practice.
Yes, I totally agree with that. I think it's genius, honestly, to have that built into the system.
When we talk about communication, you mentioned that you had been doing some teledoc work that was not as rewarding as your experience in DPC. How has that been different now that you're incorporating telemedicine into your DPC?
There's a very big difference between randomly someone having sinus pressure that you've never met in your life and someone that has never had a sinus infection with you, and they've had symptoms for 2 days, and you can follow up with them in another 5 days and see if they've improved with over-the-counter medications. And then you know their health history, and so it's so different. I remember I was between jobs and I was doing teledoc, and I sat in my room on the floor in our little townhouse in Virginia before we had moved to Texas. And I did like 15 consults that morning or something. And I was just miserable by the end of it, because it's just one after the other after the other. And with this, there is a lot of communicating with our patients via the Spruce app, but we know them, and it actually saves them from coming into the office a lot of times. And it keeps us from seeing 20 patients a day. And I don't need somebody to come in just to check their blood pressure. They can send me their blood pressure on Spruce and we can adjust their medicines that way. So you don't have to have a bunch of staff supporting you. You just take care of patients. You don't need all of those other barriers in place to facilitate people walking into the office.
It's a very vivid example that you give about sitting in your room and having that reaction.
I believe that a lot of people would find a lot of joy and freedom in practicing DPC, but that's really a personal decision everyone has to make for him or herself.
On that note, did you have or do you have medical students or residents?
We do welcome them to come into the practice. I believe, I don't know if we have an association or if there was one in the works, or there is one in the works with one of the medical schools, but that's a big goal of Dr. Vo, is to bring those students in and expose them. She was exposed in I believe, residency, but I had never heard of it. And we want medical students and residents to at least be aware of it so that when they do get into that fee-for-service model, they know that there is another option if they're unhappy. And we just want to grow DPC, really. We want more people to know about it and experience it.
And going back to what you said about when you guys are looking to hire a new physician, if a person has that exposure to DPC, I'm sure that drives them right to the top of the list in terms of, the clinics who are looking to add on a physician. I definitely was in the boat of had never heard of DPC until after residency. And I was speaking with one of my previous attendings who has now gone on to do DPC in Modesto, California. She told me that now, as part of our residency, you rotate through her clinic at St. Luke's in Modesto. And, I love hearing that there is more involvement with the medical students and residents, and that there are medical students and residents attending DPC conferences. It gives us such a sense of hope for the future.
I hope it grows.
To grow.
I love hearing you've had some of the founders on here of DPC and some people that have been doing it a long time. And I'm excited about it. I can only imagine their excitement because of the growth that they've seen while they've been in DPC.
Absolutely. Speaking with Garrison Bliss, he uses the term, we're the kids and the grandkids of the movement. And that is a fantastic way to think about this movement that is alive and well and thriving and producing and inspiring future generations. Totally, yes. So amen to that. Recently, you had posted about getting the COVID vaccine, and there has been a lot of differences between communities where independent physicians can sometimes get it very easily and sometimes it's very difficult. How was your experience?
It was so easy. I actually was planning on waiting to get the vaccine. I figured I was young enough and in good enough health that I would just let other people get it. And then last Sunday, my partner texted me and said, "Hey, I booked you for your COVID vaccine tomorrow." So I decided that, okay, I was going to get it. So we basically, all three of us, my partner, myself, and our medical assistant, we all met at HEB and we all got our vaccine. And it was very easy. There were really no barriers. I love HEB. I think everybody that lives in Texas loves HEB. It's the grocery store down here and it originated in Texas. They're so well distributed throughout Texas. They just kind of said that they would spearhead the distribution. And so far, I think it's been very easy. I know my partner had to call around to several HEBs to find one that didn't have a wait list, but I think it may be the third or fourth one that she called had available spots. So she just booked us within the window. I think it was a 6-hour window for us to go and have the vaccine, because I believe they can after they open a vial, they have to use it within about 6 hours. So they sign 10 people up in that window, and then you go and within your window of time and get the vaccine.
What about your follow-up vaccine?
The pharmacist said that they were given 100 doses and that they're going to be given another 100 to give the second vaccine to each person that got the first, but that they've also been told that hopefully they will be shipping additional doses to give out to other people.
Here the recording gets cut off, but I'm asking Dr. Snodgrass if the COVID pandemic has affected her practice. And she goes on to explain that in the early months of the pandemic, she did see some cancellations, but otherwise there was a minimal negative impact to the practice. Has the pandemic affected your practice at all?
In the early months of the pandemic, and again in September, for some reason, I did see some cancellations on my panel, but otherwise there was a minimal negative impact to the practice. We've continued to grow, and our company exceeded our goal patients for the year. From what I know of our company, we've done very well. That we could have done better if there hadn't have been a pandemic, but that patients are still needing care and they're still reaching out and joining the practice. I mean, we're adding a physician, and we just opened another a fourth clinic in Texas down south of Houston. We just opened that a month or two ago, and then our next physician's joining in January. So we are still growing. I think we could have grown more without the pandemic happening, but fortunately, we're still growing.
You previously mentioned using Slack. How do you guys work as a group in terms of how you use Slack?
We have different channels in Slack. So we have a sales channel. People will call and want to know more about membership. So we'll put the name in there, and our various people from our sales team will say, okay, I got it. And they'll call the person. We have a marketing channel where our marketing director puts in various postings and videos that she's done. We have a clinical channel, a COVID, a general channel just for, happy Thanksgiving and happy birthdays and things like that. So it's really constant communication. Every Tuesday we have a meeting. Our first meeting of the month is our marketing and sales. So our marketing and sales director, he and his staff present where we've had growth in each of the clinics, where we've had loss. And also our marketing team, they discuss which postings have had the most views and shared the most and touched the most, and all of those terms that I really don't know what they mean, but we get all of that information. So everyone in the company is aware of all the numbers, all the patient numbers and money and just everything going on behind the scenes within the company, which has been really fun because I honestly, I don't have a great aptitude for that. So I've really enjoyed learning and seeing what it looks like when a company grows. And then our second meeting of the month, I believe, is just a general meeting. And then the third meeting of the month is our medical meeting. And I typically run that. So we'll do case presentations or photo things that are interesting. We'll have discussions on various medical things that people are seeing. So that's a really fun educational meeting. And then our last meeting of the month is kind of a general meeting that Dr. Goyle runs. Knowing all of these people that are doing all of these various jobs we're all together pushing the company forward. It's very exciting to see what everyone's roles are and what's succeeding and what's not succeeding. It's a very fun experience.
I have become a huge fan of podcasts. Ever since Sarah Koenig hosted the first season of Serial, I was hooked. Now, creating this podcast has become part of my daily life. While it is an exciting new hobby, I also see it as a privilege that I get to interview so many DPC and direct care doctors. If you are interested in starting a podcast, let me tell you a little bit about Anchor. First of all, it's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast as well with no minimum listenership. It's basically everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. I want to shift to you as a physician, as a person, as a wife, and as a mother. What do you do for self-care?
I feel like at various parts of my life, I've succeeded more than others. I'm actually feeling pretty good now. And like I said before, I think it's because my youngest child is a little bit older. But I just feel like I'm kind of sailing a little bit right now. But it's a daily process, and we all have different needs. I need a lot of time to myself, and that doesn't happen a lot when you're a wife and a mother and a physician and an employee. But direct primary care and working with first primary care has brought that back for me. If I worked in the fee-for-service model, I would have to work part-time. And I actually was working part-time since my daughter, my almost 7-year-old, was born. I went part-time after she was born, and I've continued that, except for in the Peace Corps, I was full-time. But I've continued that because I felt like I was just drowning full-time, and trying to really enjoy being a mom too. It's such a life-changing experience, and I didn't want to miss out on that. So with first primary care, I don't have to go into the office every day. If I need to, I can, and I do most days, but I can communicate and do video calls with my patients from home. And at lunchtime, I can run out, and we have chickens. I can clean my chicken coop out real quick and then run back in and start working again after the lunch hour. So it's just so nice to have the option to vary my weeks and vary my days. And if my kid needs to, go to the dentist at 4 p.m., I can leave the office at 3:30 and get her to the dentist without having to go through all of that PTO and coverage and all of those things.
It's so beautiful to hear that. As a mom with formerly only a 3-year-old, I understand that beauty of they can self-manage to some extent. Like if you fall asleep on the couch on accident, they're still alive afterwards. That's a rewarding thing. But then adding an infant to it recently, I understand that even more in terms of they grow up so quickly. And for you to wear all those hats and still feel like you're in a better place now than you were in fee-for-service. It's so powerful to hear that as a mother. And, the moms who are listening, I know that those who are in DPC will empathize. I want to spend some time highlighting the fact that you are an author. Please tell us more about this.
Yes, not to take away from real authors. I did write and illustrate 2 children's books, though. When I was living in Namibia, I told you I had that year of trying to get my medical license. And so during that time, and I was teaching at the medical school and working with the medical students, but I had a lot of extra time and I just wanted to write a children's book. And so I found it's actually an Amazon company that does it, createspace.com. But I just decided to do it. And my idea was to do like a themed series of children's books about medical things so that they wouldn't be scary. And the star of the book is my daughter, Nora, and her cat, whose name is Vax, short for vaccinate. So the first one that I wrote is Constipation, Nora and the Curious Constipation. And my daughter loved that at the time. And now she is mortified. She's almost 7, and she told me to throw away every copy that was ever made because it's talking about her going potty. But it was really fun to do. I wanted to do a rhyming book. So I just wrote it out and then I made it rhyme and then I illustrated to go with it. And I used a graphic designer, I believe that's his title, in Namibia, a local person to help me kind of get it formatted. And then I uploaded it and Amazon actually publishes it. So you don't have to give money up front or buy a certain number of books. You just upload your pictures and your everything to the createspace.com website. And then every book that is ordered is just printed right away. And so you don't make as much money that way. But my goal really was not to make a lot of money. It was really just to have fun and I have my name on a book, I guess.
No, that's so cool. And I have Amazon links to both of your books on your accompanying blog. So if anybody is interested, you can just go onto my dpcstory.com and click on the links, or you can go to Amazon and look up your name. But that is fantastic because it's not something common that you hear that a doctor has also written a children's book. How about tools that you use? Do you have any favorites?
One of my favorites is the Butterfly IQ. We have really enjoyed that. We did our first in-office paracentesis, which I mean, who in the fee-for-service model would be able to do that? It was so exciting. A patient needed one, and the local hospital was offering it for $15,000. So we actually found him a guy, internist, who did the paracentesis for about maybe less than $300. This patient was needing them almost weekly by the time he left the practice, and because he had gotten on some other insurance. So anyway, but we wanted to be able to offer that to the patient. And so we just got all of the supplies, and we brought him in the office and did the paracentesis. And fortunately, we had our ultrasound that we had purchased. So that's one of my favorite big techie tools that we've gotten. One of the newer things that I'm using that I'm really enjoying is the Freestyle Libre, which is that continuous glucose monitor that you can wear for 2 weeks at a time. And I'm using it for pre-diabetics and diabetics and obese patients. And you can read your glucose. It's continuous monitoring, and you read it on an app on your phone. And this has been great immediate feedback for patients that are trying to get their diet under control. Patients can screenshot the graph that is produced through the day of their sugar changes. And I also am able to view it through Libre View on my computer to see their trends. And that is a great way for patients to see, you want to see a rise in your sugar at breakfast, at lunch, at dinner, but you want to try to keep your sugar level below 100 between meals. And I have found that patients really enjoy that immediate feedback.
And how are you guys getting access to Freestyle Libre?
We are getting it through a prescription that we give to patients, but you can also get free samples through the Freestyle Libre company by going online and for free through Libre. And so I do have those in the office. The monitor, though, you send it like a prescription, the sensor. And on GoodRx, it's $65, I believe, in our area. But at Costco, for some reason, our patients are getting them for about $35. So it's $35 for 2 weeks of continuous monitoring. So that's how we're doing it.
I was unaware of the Costco pricing, so I hope that people who are listening to this quickly call their Costco pharmacies.
For those who are learning about or considering entering into DPC, what advice would you give them?
First, I would learn about DPC. Almost all people in the DPC movement want to spread it. They want to talk about it, and they want to do it in their free time. But if you're in a situation that you're not happy with your work, or you're in a place where you are being instructed by a lot of non-medical people how to practice, or you feel isolated and you've lost the connection with other physicians, I highly encourage you to look into DPC. And I've seen many times where DPC practices have grown so much that DPC doc is looking for someone to join. And in that setting, you have that framework set up already, and you can just come in and learn the system and grow your own patient panel. But it's really a life-changing experience. And I highly recommend to just do it. Just try. I feel very fortunate that I'm in a double income home. And so financially, that wasn't a super stressful thing for me to just come in and try this new type of medicine that I'd never heard of before. So I empathize with people that, they may be single income and it's a bigger risk for them to take. But if there's a way to moonlight and make it work, I think it's worth a try for anybody.
Do you have any other resources you would recommend to others?
My favorites are the DPC women and the DPC physician pages on Facebook. I find it's very informative. It's also hilarious at times and relatable, educational. And so I just love that forum. And if you need the official resources of how to standardize your practice and all of that, then there's always the DPC Frontier and all those great websites, and also some books that people have written.
What is the best way for others to reach out to you if they want to connect after the podcast?
The best way to reach me is at my email, Dr. Snodgrass, drsnodgrass @firstprimarycare.com. I would love to engage and help anybody else that is considering DPC or has questions about DPC or growing their practice.
Thank you so much, Dr. Snodgrass, for joining us today.
Thank you for having me. It was a lot of fun.
Next week, look forward to hearing from Dr. Mashira Jackson of Lutz Family Practice. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends, too. For more information on this episode and much more, please visit mydpcstory.com. And remember, for up-to-date information on DPC, check out dpcnews.com. Until next week, this is Marielle Conception.